Focus. Ideate. Innovate. Enable.
According to WHO and the Indian Council for Medical Research, heart disease is the single largest cause of death in the country, with heart attacks being responsible for 1/3 of all deaths. And by 2020, India will be the heart attack capital. That's frightening. CNBC TV 18's AB Ravi spoke to eminent cardiologist Dr. Ramakant Panda to find out what is the cause for this alarming rise and how do we keep heart diseases at bay. This is what he has to say. Take a look.
Dr. Panda, welcome to the show.
It's my pleasure.
If I may begin by asking you, every minute 4 Indians die of heart attack and they are in the age group of 30 to 50 years. What is the reason for this alarming figure?
I think it's a large extent because of the lifestyle changes that Indians have gone through over the last 30-40 years, mainly related to very sedentary lifestyle now. People are not doing any exercise, any physical activity. Number two is the food habits have drastically changed. We are eating a lot of food which is very high in cholesterol, saturated fat. Third thing is, of course, stress, and then quite a bit use of tobacco as well as smoking. So all these things have, this total lifestyle change has created a situation where many people are becoming hypertensive, high blood pressure, diabetes, all these factors, what is called lifestyle related factors, which is causing this alarming increase in heart disease. If you look at it 30-40 years back, rarely you could see somebody who is below 30 or 35 years of getting heart disease. Today almost every day we see patients who are below 30.
So is it an urban phenomenon, or does people in rural India also have heart attacks?
See, it was, till recently it was almost like urban phenomenon, but not anymore. If you see last 10 years trend, the rural areas are catching up quite a bit, and probably in next few years there will not be much of a difference between rural and urban India.
But by Indians, by definition, are they genetically prone to heart attack? But I was told that there were small coronary arteries. Is that also one of the reasons that they have heart attacks in India?
I think it's not really genetic, it's more related to lifestyle, related to our lack of exercise, and I think those are more related more to that rather than real genetic cause. Okay. So earlier used to think that is genetic Indians are rather people from Indian subcontinent, they are more prone to getting heart disease. But I think it's a large extent it is related to lifestyle, the way we don't do that much exercise, we don't, food habits, all these things has contributed.
But doctor, we have also heard people who are very health conscious or fitness conscious, jogging and gymming, also getting heart attack. What is the reason for this then?
I think there are two. One is the number of people who are doing gymming and number who are getting are very less. So occasionally somebody gets a heart attack, so that becomes a news. But for every person getting heart attack, well, 99.9% people don't get any. That's one. Second reason is also a lot of these people might have a risk factors which they themselves don't know. Suppose they might have a high blood pressure, diabetes, cholesterol might be high, which might have produced a cholesterol plaque inside. Third thing what happens is sudden heart attack is many of these patients, many of these people will have a cholesterol deposit only inside the artery without any blockage. Okay. When you are not, suddenly you start doing some exercise which is way beyond what you are normally do, unaccustomed exercise, sometimes that thing can rupture. So these are the three reasons why you see this.
Is one of the causes of death is because of demand-supply mismatch, doctor-patient ratio or patient-bed ratio. Healthcare is not accessible. So how do we change this? I was told there are one doctor for every 11 to 85 patients. Is that right?
Yes, you're right. It's 0.7 doctor, you are right, for 1,000 population. If you take into China, they have got 3 times as many doctors. So I think there's a huge supply-demand mismatch. I think the only way it can be done, one is increasing the number of more medical colleges, allowing more number of seats so that more people can come out with MBBS. And I think the second also equally important is, if you see rural areas, still a large extent the major healthcare problem is sanitation, nutrition, hygiene, diarrhea, all those problems. So those things can be tackled by a group of doctors which don't have to go through 5 years training, which the health ministry had a proposal, they're working on it. If that works out, I think it's a very good idea to train these people in 3 years. send them to rural areas where the majority of problem is sanitation, hygiene and nutrition related, who these people easily can treat them. Yes, they can easily can treat those patients. You don't need to have a MBBS doctor who doesn't want to go to a village. So I think that on one end,
as far nurses be trained to do that? Nurses can be trained to...
Nurses also can be trained to do that. Many countries, you see USA, nurses are trained to do the anesthesia work, critical care work, everything. The other end of the spectrum is specialists. There is a tremendous shortage of specialists in the country, whether the heart doctor, the kidney doctor, lungs doctor, everybody, there is a tremendous shortage. That's again artificially created because most of the countries, even USA, number of people who come out equivalent to MBBS, number of specialist positions for training is almost double. In India, it is 1/10. The number of doctors who come out, only 1/10 seat is available for post-graduation. It is a complete artificially created, which easily, if it is allowed to all the large good private hospitals, if they are allowed to give the same postgraduate degree, which happens in USA, entire Europe is like that. 80% of the postgraduate degree and training today takes place in private hospitals.
What is India, policy level change has to be, policy changes has to be done.
It can do that, allow all the large hospitals which to give postgraduate education. Overnight these numbers can be changed because we are producing quite a significant number of MBBS doctor, but there is this big bottleneck in terms of giving postgraduate degree, huge imbalance there.
Doctor, what are the main kind of heart disease that people suffer generally? Is it blocks or the other cardiovascular disease? Generally, what are the people suffer?
Yeah, there are 4 types of mainly category of heart disease. One is ischemic heart disease that everybody knows about, the blockages, heart attacks. The second commonest is the children's heart disease. Third one is patients who have got a valve problem. Fourth is a muscle weakness called cardiomyopathy. But the first category that I talked about, ischemic heart disease, that affects all majority of patients. Almost 80% of the patients in India are in that group.
So what is the symptom for that?
Symptoms is mainly people, this occurs in, when the person is stressed out. Either during physical or mental stage, you start getting chest pain, and the moment you take rest, it goes away. Again, chest pain unfortunately is only present in 50–60% patient population. 30–40% do not have symptoms, or they have other types of symptoms like breathlessness. While exerting yourself, you get breathless. Sometimes this pain also you can get in the jaw. People have gone to dentist and got treated, but they had heart problem. You can get a hand or shoulder pain, and you can get a stomach pain, because all these areas, the nerve supply comes from the same source. So heart pain is called referred pain. It can happen any of these places. So yes, so basically we look at people who have got a high risk, like diabetes, high blood pressure, smokers, or strong family history. And if they have this kind of symptoms, immediately they should try to get themselves investigated.
Doctor, according to WHO and Indian Council for Medical Research, by 2020, India will become the heart attack capital of the world. Or India will become the heart attack capital. Now, this is a worrisome statistics. How do we tackle this?
It's almost we have become heart disease capital of the world. If you look at it, Indians or people from this subcontinent are almost 3 times more likely to get heart disease than any population anywhere in the world. The other thing, there was a statistics from WHO again, who have predicted that between 2005 and 2016, almost $240 billion loss will be because of loss of productivity from lifestyle related diseases. And major part of the lifestyle related problem is diabetes and blood pressure, heart disease. So it's getting very, very common.
So what is the role the government has to play according to you?
I think government has a very, very significant role in all aspects. One is affordability, providing universal healthcare insurance, which many countries in the world have done that. I think that especially at least to below poverty line and people who the lower mid-income group, to providing universal healthcare insurance. Number 2, of course, increasing the number of specialist training positions all over the country.
Supply side.
Yes, supply side. And third thing, I think they can also help in quite a bit. They can is in health education, making people aware about it and enforcing certain regulations like avoiding, putting a ban on tobacco or both in terms of smoking as well as in terms of tobacco use. They're completely putting a ban in the country. Those things they can do.
Okay, finally, doctor, what is the advice you would give people to avoid heart attack in terms of their lifestyle or in terms of the habits, in terms of everything?
My advice will be to entire population, to entire country is to go on a preventive way. Try to prevent the heart disease rather than wait till the heart disease happens and then you try to get treated. It's going to be very, very expensive, and hardly 10% population can afford. So it's very, very important to go preventive. That's where you have to be very strict about your diet, your exercise, yoga, and I think everybody above the age of 30 should at least get once in a year checked out to make sure that to identify in case they have got diabetes or high blood pressure, because these are called silent killers, because most of the time these patients don't get symptoms, especially those who have diabetes and high blood pressure. It's only after many years when it is already damaged many part of the body you come to know about it. So I think very important to do a preventive checkup once in a while to make sure that you don't have diabetes or blood pressure risk factors. Lead a healthy lifestyle and do adequate exercise. If you ask me, one thing that can the most effective in reducing heart disease is exercise, leading a very active and physical active lifestyle and doing exercise daily.
Dr. Panda, thanks a lot for talking to us. It's a pleasure.